Welcome to the press conference for the Johnson County Emergency Operations Center for Friday, March 27th. My name is Kelly Andreessen, Public Information Officer for Johnson County. Thank you for those in the media reporting on this and to our community partners for participating. Just a few reminders, we are working with American Sign Language interpreters for this press conference, so reporters, make sure that you're including them in your shot. We are streaming this live on Facebook on the Johnson County Public Health page. We do have Krista who will be going around with a microphone. So for our reporters, if you do have a question, please raise your hand, state your name and your affiliation, and then ask your question so that those who are tuning in remotely can hear. We are practicing social distancing, so we have a limited number of people in the room. We've limited it to less than 10, and for those purposes, I will bring in each speaker one at a time. They will make their statement, and then we will open it up for questions from reporters for that person. If you do have follow-up questions with that individual, touch base with me, and I can get you connected after the press conference. As you all know, this is a rapidly changing situation, and so we are sharing the information that we have at this time. And so we thank you for your patience, understanding, and flexibility. And with that, we'll get started with Sam Jarvis. He's the Community Health Manager for Johnson County Public Health.
Thank you, Kelly. Good afternoon. To date, Johnson County has had 58 positive cases and 18 recovered. The state as a whole has 235. The state has also reported that there have been roughly over 3,000 some negative tests performed by our partners at the State Hygienic Lab and other labs, reporting to Iowa. We also wanted to take the time today to describe our investigation process. We know that we've received a lot of questions about that, and we want to be sure that we're very thorough and taking the moment to describe this so that everyone's on the same page. A positive test for COVID-19 will be reported from any lab to IDPH, the Iowa Department of Public Health per law. This will trigger an alert to local public health throughout the state through the state's disease surveillance system. And once this alert comes through, a trained disease prevention specialist at local public health will make contact with the person and review the course of their illness, identify high-risk contacts. A high-risk contact can be thought of a household member, but disease prevention specialists will also assess other risks based on specific circumstances, symptoms, and timeframes to determine if there should be other persons considered a high risk. If anyone is identified to have a high-risk exposure, they will also be contacted by Johnson County Public Health. Due to community transmission in Johnson County and in Iowa, everyone is considered to be at some level of risk. This is also why the state has implemented other community measures for social distancing. After the disease investigation, disease prevention specialists will review self-isolation guidelines for the ill person and for their contacts who have been identified. Ill persons check in daily with our disease prevention specialists to report the progress of their illness. This information is used to determine when a person is no longer considered infectious, and a recommendation for release from self-isolation can be made. Contact tracing is and has been a major part of this disease investigation and many others, along with all the other community measures that we're seeing, like social distancing, cough etiquette, and hand hygiene. Yesterday, Governor Kim Reynolds extended the closure of businesses that were already in effect till April 7th and added additional non-essential businesses. A complete list can be found on their website. If you're unsure if you're included in this list, we'd encourage you to reach out to the governor. But the intent is to continue to limit exposure and implement social distancing, which is what we're recommending for everyone. Collectively, our strategy is to implement social distancing and hygiene in all aspects of our lives. Whether it's covering your cough or washing your hands, limiting our movement or physical interactions, restricting visitors, or flexible or telework schedules, social distancing is our way to protecting the public. Other strategies that we are implementing are recruiting for our Medical Reserve Corps here in Johnson County. We're asking persons with any sort of medical background to volunteer for the future. Our goal is to begin onboarding interested participants in the statewide registry for volunteers. You can find more information on our site. We continue to work with our partners to address the needs of our community and plan and prepare for the future. Thank you, and I'll take any questions.
Hillary Ojeda from the Press Citizen. Could you talk about the who would be considered a high risk while you're doing the contacts investigation? So if someone tested positive, what kinds of people would be considered high risk outside of like a family member? So people in the community.
Yeah, absolutely. Again, household contacts, people with that prolonged exposure. So we're looking at within that 6 feet distance or prolonged contact time. If that clears that up.
Could you give it an example? I'm sorry.
Yeah, sure. So it may not be a household contact, but it's someone that's with that person for an extended period of time, a friend or family member visiting for a while. That would be an example.
Hi, Erin Jordan with the Gazette. Up in Cedar Rapids, they've closed down playgrounds. Is there any move to do that? Do you think that's necessary down here?
I defer to our municipal leaders for that. So.
But have you given any recommendations to them? Because I'm sure they'd look to you guys.
Yeah, absolutely. The recommendation would be to implement social distancing as best as possible. So that may include that, but again, that would be a decision on them. And what we'd provide is that if there is a way to maintain that 6 foot distance as best as possible, that'd be best. But if not, that's something to be considered. So.
Sarah Watson with the Daily Iowan. I'm wondering if you could elaborate more on the Medical Reserve Corps. What would those people do or like be used for in the future?
Right now, we're looking at the Medical Reserve Corps as a national organization established by the federal government, and we have a local chapter here in Johnson County. Right now, the process and goal is to onboard medical professionals into that statewide registry for future projects or medical surge. So right now, there is no current project or missions that we deploy them at, but getting them into that statewide system helps with credentialing and licensing for the future.
About the following up from her playgrounds question, how long does we've read a little bit about how long coronavirus can last on like plastic, for example. Is there any concern that coronavirus could be living on playground equipment?
Great question. So there could be, right? And I know that New England Journal of Medicine article has been cited a lot with all the different contact times and different materials. When we're looking at infection, people are primarily infectious when they're sick, so that cough onset and fever. And so that's why we're always asking people to be mindful of hand hygiene. So as they're climbing on playground equipment or things like that, that's really important.
Mitch Fick with Iowa's News Now. There's still a lot of talk about just the verbiage of shelter in place, and Dave was here on Wednesday, I believe it was, and said that's a conversation with the county, and Lynn County is involved in the Johnson County conversation. Governor Reynolds yesterday then says that's going to be a state declaration. That's not going to come from cities and counties can't do that. Bruce Teague, though, then yesterday also saying if the governor won't do it, I'll declare one for Iowa City. What's the latest on those conversations? Is there a big difference between stay at home and shelter in place? Because I know the nomenclature kind of depends where you are in the country. I mean, there's stay at home in Tampa Bay, Florida, I know is kind of the same as shelter in place in San Francisco, California. Is there too much being made of the verbiage and all of that?
I'll defer all questions to Rod Sullivan, our Board of Chair Supervisor, who will be speaking after this. So.
Hillary again from the Press Citizen. How many people are part of the contacts investigation team?
Right now, currently 2, and we're looking at onboarding 2 others. We also have assistance from the Iowa Department of Public Health, who originally helped us out when we had our first cases. So we could look at a potential of total of 6 and more. So.
And how many cases are they currently tracking?
Total positive cases? I don't have those numbers in front of me right now, but we can get that. So.
Just to clarify, so have you given a recommendation, yes or no, to city officials about playgrounds?
To my knowledge, I don't believe so, but as always, we are giving out guidance and best practice about how to implement social distancing, but I'd have to get back to you on that.
As far as a recommendation for shelter in place, yesterday Dave Coach to the Johnson County Board of Supervisors had said that that it would be difficult to have some kind of metrics or thresholds developed by the Johnson County Public Health Department. And so I was wondering if you had any more on just like what Johnson County Public Health's recommendation for a shelter in place was.
Again, Rod Sullivan will be speaking after this to talk about shelter in place potentially. In regards to the metrics, I know those conversations are going on. I've been privy to a couple of those conversations, and I believe they're still going on to determine what those metrics are or could be, and really what they could convey to our community leaders and our partners in Lynn County. So.
Travis with KWWL. When talking about the patients who are receiving inpatient care at hospitals in Johnson County, what can you say about what percent of those patients have been driven in from a different county, or what percent are Johnson County cases? Can you talk a little bit about that?
I don't have that information, but I defer that to our hospital partners individually.
Do you know how many cases of the Johnson County cases are community spread, or if how many are have been traced to other cases? I know you said earlier you didn't have a number on exact cases you were tracing right now, but I'm wondering of the number of cases in Johnson County, if you know how many are community spread or can be traced from person to person.
After we announced that we had community transmission here in Johnson County, you can think of most of those cases being related to that. It'd be really difficult to determine whether or not it was from domestic or international travel at that point, given their interactions. So, thank you.
Just following up on that, is it too much of an assumption to say that going forward, the majority, if not all cases, would be community spread, or is there still a possibility of those international domestic travel situations?
There's a possibility of that if people are traveling, but for the most part, we've seen a lot of travel restrictions and recommendations not to travel. So it would be probably safer to assume that it's from community transmission. So.
Hillary again from the Press Citizen. Of the contacts of positive cases that have been established as high risk, how many of those have been tested?
I don't have that number.
Do you have a percentage?
No, not in front of me.
I guess in general, following up on that, is it easy to trace where a case comes from if somebody tests positive, or are a lot of these cases just somebody develops symptoms and they don't know how?
Our thorough investigation process goes over that, and so it takes a trained disease prevention specialist to really be able to help jog the memory of those persons. There's all other things and questions that can kind of prompt where those persons have been. So they do take quite a bit of time. It's not just a quick phone call. So, but that's all covered in the investigation. So.
What is the current understanding of when someone is infectious and when they're not infectious, based from the public health department here?
Again, when we're looking at symptom onset, first signs of cough and fever, we're looking at them being most infectious. And so that's really a crucial point in the investigation. The Iowa Department of Public Health has released guidance that's pretty similar, I believe, to other national and other state guidance, where deemed no longer infectious is 7 days from when symptoms first appeared, and 3 days fever-free and symptoms improving. So, and that specific guidance is on their site.
So is someone non-infectious in the first few days if they might not be showing signs?
Could you rephrase that question?
If someone has the illness, but they might not be showing any symptoms, are they not infectious?
I'm not exactly sure. I defer that to the Department of Public Health. I know that there's a lot of discussion around that. So, but I would tell you that we're really looking at that cough onset and fever when that begins. So. All right. Thank you.
All right, now we have Rod Sullivan, chairperson from the Johnson County Board of Supervisors.
Good afternoon. As you know, Governor Reynolds has signed a new proclamation continuing the state public health emergency declaration, which expands certain retail business closures. This has affected many Johnson County businesses, and a number of businesses not affected by the declaration have elected to scale back their operations to encourage social distancing and help contain the spread of the COVID-19 in our community. To all those businesses, we thank you. Today, the Johnson County Board of Supervisors is asking Johnson County businesses not affected by the expanded declaration that have not already done so to consider modifying their operations to reduce the number of employees physically in the workspace. This will help create more effective social distancing for the safety of their employees, customers, and our community. Based upon the recommendations by Johnson County Public Health, the Iowa Department of Public Health, and the Centers for Disease Control and Prevention, we are strongly encouraging businesses to allow employees who can to telework from home to do so, implement staggered shifts and/or rotation of in-office staff, implement flexible sick leave and supportive policies and practices, among other things. And for those of you in the community who are already at home working, taking care of family members, or self-isolating, thank you for helping to keep our community safe. All of us working together will help contain the spread. And with that, I'll take questions.
Mitch Fick from Iowa's News Now. There's been a lot of discussion in the last 72 hours, before that even, about shelter in place, the terminology difference between stay at home. Governor Reynolds yesterday saying counties and cities can't make that call, even though Mayor Teague just yesterday also said if the governor doesn't, I will for Iowa City. Dave Coach was up here the other day just talking about the conversations between Johnson and Lynn County and how that could be kind of a collaborative process. If you could just speak to the current conversations now of shelter in place. I know a lot of people are confused about what the true separation is between that and stay at home, and I know in different parts of the country those are almost synonymous terms in some cases. What does that pertain to here in Johnson County?
Well, let me back up first of all to say that after discussion with our county attorney, she is of the opinion that we do not have the power to issue such an order. So we are working on that legal opinion being correct, and so we're not pursuing that. However, we are going to send a letter to the governor to urge her to consider perhaps doing what some other states have done, which is taking that next step. In terms of the actual differences, I think there's a lot of debate out there in the both in the public health community and just folks in general. What would the actual differences be between a full shelter in place with the many exceptions and what we have now? And I don't know if anybody really knows.
Mike O'Brien with KCRG. Governor Reynolds kind of highlighted a list of industries that are considered as essential and non-essential. In terms of the county, how do you and what's the process of determining what specific businesses should stay open, should stay closed, if they might categorize themselves individually as an essential business, and for the ones that are staying open that perhaps shouldn't, is there any procedure to enforce closure of the business, or is it more just an encouragement from the county?
Well, remember, we don't have the ability to do anything legally here. Our statement is simply to encourage folks, and that's exactly what it is simply to encourage folks. If you haven't done anything yet, please consider it. There is no enforcement because it's just a suggestion.
In terms of those specific businesses, though, coming to the encouragement, is it kind of as, I don't want to use the word, is it a more broad and vague, if you think you should close down, please close down, or is there any steps of contacting private local small businesses?
We're not taking any steps of contacting anybody. Frankly, I think that's probably a much bigger project than we have the ability to carry out. We just hope people get the message and act accordingly.
Hi, Rod. Erin Jordan. Wanted to ask you, the public, Sam was just saying that the state or the county public health department hasn't necessarily made a recommendation one way or another about closing playgrounds. Have you guys talked about that in the Board of Supervisors, and what have that discussion looked like?
That specific issue has not come up. We have had some discussions about parks in general. We feel like our county parks and trails are going to be even more critical during a time when folks are unable to, get out and see other people. People are going to need exercise. They're going to need fresh air, and they're going to need the mental break that comes from getting out and forest bathing, if you will. So we would be very, very reluctant to close any parks or trails. Playground equipment is a specific thing that we haven't had a lot of discussion with. I would imagine that we will look to other places that are further along for guidance in terms of how they've handled that kind of thing, and I'm sure that our conservation department would handle it according to those guidelines.
So the National Guard is deploying some members across the state, and I'm wondering how that affects Johnson County, or what's going on there for the National Guard here in the county, how they're helping out.
I'm not aware of any specifics. I know that we've had some National Guard representation here at the EOC for at least a week now, and that's very welcome. We love to have more partners involved, and I don't have any specifics beyond that.
Travis with KWWL. When you opened, you talked about businesses that may not have specifically been affected by some of the things the governor has said, and I'm kind of racking my brain trying to think of them. So are you directing that message to like law firms and offices and stuff? I'm just trying to think.
There's nobody particularly being targeted here. It's just we'd like to ask each business to take a look at what they're doing, and is there more they could do? And I don't think we don't have any intent of coming out and policing that in any way. They're going to have to answer that question for themselves. But we know from our own operations, we have been able to get a lot of people working from home, and probably more even than I imagined we could in the beginning. And so I just urge everybody to look at that and do the best they can.
I'm trying to think of the county employees who may not be able to work from home. We talked about you hoping to keep parks open. What can you say about safety measures for county employees who are going to continue, like maintenance workers in the parks and stuff, that would continue to be out in the world? And what have those conversations been like?
Well, their jobs in general are pretty isolated. They often would have a morning meeting and then come back together for lunch, and otherwise they're working pretty independently. So we're just saying, don't do those meetings and do the lunch on your own. And otherwise, those are people that are working, really independently, not really within 6 feet of anybody all day long. So right now we feel like they can do their jobs.
Thank you.
Anybody else? I do just want to remind everybody, because it's been my mantra and I've done it every time, please be kind, please be calm, please be patient. That'll help everybody get through everything. Thanks.
All right, now we have Margaret Reese, Public Information Officer for Mercy, Iowa City.
I don't know if I need to spell that or not, but I will. Margaret, M-A-R-G-A-R-E-T, and Reese is R-E-E-S-E. So on behalf of Mercy, Iowa City, I would just like to remind everyone that prevention is critical, and that is something that everybody can be doing to help, is by doing everything they can to prevent contracting this disease or spreading it to anyone else. We are continuing to meet regularly with the city leaders, city managers, mayors, Johnson County Department of Public Health, Johnson County Emergency Management, the chief medical officers of the 5 area hospitals in Johnson and Lynn County, the intensivists in those hospitals, all meeting together, talking together to address supply chain issues and the challenges that we are all facing, and working together for the common good of everyone. We are continuing to urge that people stay home except for essential reasons, shopping for food, going to the pharmacy, or going to work only if you are in an essential position, and to follow the CDC guidelines that I think everybody knows about, to stay home, the social distancing, washing your hands often, and so forth. We at Mercy have ramped up incredibly fast to meet this challenge and to be prepared. On Monday of this week, our Mercy clinics began offering telehealth for the first time. We have appointments through telehealth, which gives us a chance to reschedule many appointments with our patients and stay in touch with them, the ones who need regular checks and supports. It's going very, very well. We activated our ILI, influenza-like illness clinic, but we are calling it an acute respiratory clinic on Wednesday of this week. So it is one coordinated location for the patients of our 25 Mercy primary care and specialty clinics and our urgent care who are experiencing respiratory symptoms. And they can go to one place to be seen and to be tested if that is warranted. Currently, they are testing for strep, for influenza A and B, all of which we are still seeing in large numbers, as well as COVID-19. And just a very important reminder to everyone, patients must receive a medical order to have a test done. So you can't just show up at one of these clinics. So individuals can call their provider, or if they don't have a provider, they should call Mercy on Call to be screened in the clinic or via a telehealth appointment before a test can be ordered. PPE, or personal protective equipment, continues to be in extremely short supply, and we are not receiving the full orders that we would like to receive on a weekly basis, and some orders have been delayed. And I think this is true for every hospital in the country. We have begun receiving some donations through Johnson County Emergency Management and from businesses, from other healthcare professionals in the community and individuals in the community, and we are enormously grateful for these contributions. A group of our colleagues began making face shields last week. They've now completed more than 1,200 of those. We have a colleague who is making stands for tablets and personal phones to help the doctors with their telehealth appointments. He just did that with scrap wood that was in his garage over the weekend, and they're really nice, actually, and we appreciate that. We have many people in the community, several hundred actually, who have asked if they can help by making surgical masks, and we have a pattern and instructions on the COVID-19 page of our Mercy Hospital website. The masks will be able to be placed over surgical masks and N95 masks because those are in short supply and we are trying to preserve what we have. And they'll be a great help if we are unable to procure what we need. So the website is the place to go for that, and we appreciate those donations as well. There is also information on the COVID-19 page of Mercy's website of what our needs are and how to deliver a donation of equipment or supplies. And currently, we need liquid soap, we need masks, and we need surgical gowns. And I think that's probably true everywhere in the state of Iowa. And I don't know if this was explained earlier this week or not, but we have indeed converted our largest nursing unit to be a secure, isolated location and all negative airflow for patients who need that. We have put walls where there weren't walls before, so there is a private elevator completely isolated for those patients and the caregivers and so forth. And so we are prepared that way. That happened in a very, very short period of time. And I just want to say that Mercy, along with the other hospitals in Johnson County, we have been leaders in the state in responding to the COVID-19 pandemic. We are all being called upon to serve our community in an extraordinary situation. This is the work that we all do. We expect our staff to step up. We need everyone in our communities to do the same to keep our families, our friends, coworkers, communities, and all of our healthcare workers and emergency responders and others who have to work on our behalf safe. So I'm going to close also with saying, please do everything you can to prevent the spread, to stay home, not mingle with others, follow all the precautions and so forth to try and keep this from being a surge in Johnson County and in the state of Iowa. So, are there questions? Hi, Erin.
Hi. Margaret, could you talk about, I know that UIHC said that they had talked with the U of I about potentially using the dorms if healthcare workers needed to be near the hospital. Have you made any sorts of arrangements like that for your staff at Mercy?
We're working on that right now. We happen to have a 15-room guest lodging in the hospital, and we are not using that for guests right now. We closed that. So that is an option that we have. And in addition to that, a number of our area hotels have offered us really remarkable rates, $49 a night and so forth, if we need to use some of those. So that's another example of the community stepping up to assist us during this time.
So, let's see here. Earlier, we heard from one of the person at Johnson County Public Health about a MedCore type thing that people were getting people with medical experience registered for in case of like staffing needs. And I was wondering if Mercy was like asking people maybe to like come out of retirement or like doing anything to add staff to Mercy in case of a surge.
We're not doing that at this time, but there are certainly individuals who have retired from our medical staff who are, asking that question, and so we'll reach out if we need to. Okay, thank you very much. Oh, sorry.
Can you give an update on how many people are being treated inpatient at Mercy, Iowa City, and if you can, how many of those are local people from Johnson County?
I have no idea where patients come from. That is not information that I have. We serve the entire southeast quadrant of the state, so Johnson County, east, west, and south to the Missouri state line, and I don't have that kind of information. I know that we have to date, I think as of this morning, I believe we had tested 116 people so far in the last 2 weeks. We have had several patients that have been cared for in the hospital who have gone home. We have several patients there again now, and hope that they'll be going home. So most patients are testing negative, and many who test positive can go home and just self-isolate at home.
Can you give me a number that's people inpatient who have people who are currently still there right now?
I don't have that number with me right now. I'm sorry.
Okay.
I don't.
You talked about a need for liquid soap. That's something
Yeah.
that I don't think we've heard yet. Is that to clean and reuse PPE?
No, it is not. It's for hands. We have dispensers everywhere for liquid soap next to sinks, and they're big plastic dispensers with a big plastic jug inside, and we can't get those. I believe I heard this morning that, I think this is the right information, although I could be getting my facts mixed up, that they're stuck on a truck somewhere near the Canadian border, and we can't get soap. So we are pulling it from other locations or places that we're not using, making sure that we have a supply. But just in case, in places where you won't be going in to see a patient, but you just want to wash your hands, if we have liquid soap as a backup, in pumps, then at least we have more soap available in the hospital. But as I said earlier, we are having issues, as everybody is, with supply chain and getting some of the most basic things that we need. So we're asking for liquid soap too.
Hi, I didn't introduce myself earlier, but Sarah Watson with the Daily Iowan. I'm wondering, we're hearing just nationally about different treatments such as blood plasma transfusion from recovered patients to sick patients to help them recover. I'm wondering if Mercy is doing any kind of treatments like that, or
Well, we're not a research hospital, and so we are not following those types of protocols, but we are doing what is being recommended by our National Institutes of Health and the CDC and so forth. So we're following those traditional protocols, and we're not experimenting with other things. That is not part of our mission. Okay, thank you.
All right, now we have Rochelle Honey Arcement, Director of Mobile Crisis Outreach for Community Crisis Services and Food Bank.
Thank you for having me here today. As we continue to work towards flattening the curve by engaging in social distancing and cope with the ongoing and continuing changes to our lives and the uncertainty about our health and financial well-being, it is natural that we will start to see an impact on our mental health. Common feelings people may be experiencing are anxiety, depression, irritability, and anger due to the isolation and uncertainty that we are all facing. These are normal reactions to the situation that we are all facing, but there are things that we can do to lessen their effects on our lives and on our relationships. One of the most effective ways to ease suffering is to stay connected. Talk to family and friends on the phone or using one of a variety of video chat apps. Reach out to your support system and check on one another. With regards to news consumption, stay informed so you have knowledge, but limit your news sources and how much you are reading and watching the news. Focus on what you can control. It is easy to get overwhelmed with everything that is going on. Be mindful of what you can do and try to focus on the here and now and not get caught up in an unpredictable future. Maintain a routine as much as you possibly can. Have a schedule, and having a schedule and predictability is helpful for reducing anxiety. Take care of your health. Exercise, eat healthy foods, drink lots of water, and make sure that you are sleeping. To stave off boredom, which can increase anxiety and depression, have activities that can distract your mind and keep your mind busy, such as reading, listening to music, playing games, watching movies, and doing arts and crafts. There are free or low-cost learning sites online where you can learn something new and engage your mind. Remember to breathe. Take a break when you need it. Be patient with yourself and with others. This is a stressful time for all of us, and you are not alone. If you find yourself or someone you love becoming overwhelmed and these techniques are not working, there are resources for getting help. There are online resources and agencies in our area who can help. Community Crisis Services and Food Bank has been in Johnson County for 50 years. Our crisis intervention services are available 24 hours a day, are confidential, and free to anyone who needs to talk with a trained counselor. Our 24/7 phone, text, and chat services are available by calling or texting 855-325-4296 or reaching out at iowacrisischat.org. You'll be connected with a trained counselor who will listen, help you explore your feelings, work with you to create a plan for safety, and connect you with resources as needed. The Mobile Crisis Program is still available 24 hours a day, but due to the current crisis, we are responding via phone or video chat rather than in person, which is our typical response. Our mobile crisis counselors are trained to deal with a variety of mental health crises, including suicide, psychosis, substance abuse, anxiety, depression, parent-child conflict, and partner conflict. We also follow up with our clients and become part of their support system, checking in as the client needs us to, decreasing the effects of social isolation. Our counselors are familiar with local resources and make referrals to our collaborating agencies in the county who provide mental health services as part of the continuum of care. Many of those agencies are providing services via telemedicine at this time. Our counselors can work with you to make the appropriate referrals. To learn more about these mental health resources in our community and online, please visit our website at www.builtbycommunity.org/resources or call our mobile crisis team at 855-800-1239 or our crisis line at 855-325-4296. Thank you very much, and remember that there are people in our community who are here to help. Thanks. You can take questions.
Travis with KWWL. I know we're at a time where a lot of things are being scaled back, but with a lot of kids at home right now looking for activities, I was wondering if there was anything that a group like United Action for Youth may have thought of recently to help with the situation.
So I know that United Action for Youth are taking actions to provide, telemedicine and also possibly doing some of their groups online. They are one of the agencies that we have on our webpage. If people want to be able to go and they can find the links to that organization. I know that they'd be happy to talk with anyone about what they are providing, but I know they are providing services at this time too.
Can you also speak on behalf of the food bank?
I can. It's not my area as much, but I do know some of how we're operating.
Could you just give us an update on maybe what kind of, if people could donate things other than food, or what's the situation?
So right now we're not taking in-kind donations just because of the risk of spread. We are taking financial donations. If you have items that you would typically donate, later we may take those again. But right now we're not taking donations, but we are doing grocery bags given to folks instead of having people come in and shop. We are using social distancing. We're following all of the recommendations about that as well that have been put out by public health.
When you say grocery bags, that means you are putting food together in a bag and giving it to someone outside of the food bank? Okay.
Yep.
That's all I got. Thank you.
Mm-hmm. Yep.
Along those lines, how's your supply of food holding up?
We continue to have food, and we continue to purchase food. But as you may know, we may start seeing more people needing food supports as this goes on. So we are, of course, always taking donations. That is not my area. So if you have more questions about the food bank, I would recommend calling our business line, and there would be Sarah Witchery would be happy to talk with you about the food bank and where they are right now. Sounds good.
Alrighty, now we have Brad Kunkel. He is with the Johnson County Sheriff's Office.
Good afternoon, everyone. I don't have a prepared statement. I know I've communicated with some of you over the last week or two, mainly about jail operations, but just wanted to touch base, see if anybody had any other kind of Sheriff's Office related questions or jail related questions or anything like that. I'd be happy to take them. Yes.
Hi, I'm Erin Jordan with the Gazette. What's your daily census like right now, and are you making any efforts to release people to lower the numbers in the jail?
So we started those efforts probably closer to 2 weeks ago. Right today, our census is right at 28. I think we still have about 10 housed out of county. Last week or so we were in the mid 30s, but every day we seem to kind of start pushing that number down a little bit. We've had a great relationship working with the courts and the Department of Corrections to try and release some of those folks that we can to keep that census down.
Just as a quick follow-up, is that, I know you say you're working with courts to release some of those folks. Is it also helped by the fact that you have, 20,000 fewer people here in town and people are staying at home, or fewer people getting charged with crimes right now?
So that's part of it too. Our daily intakes are down also. Again, the last couple weeks, law enforcement in general has kind of undergone a pretty large change in operations, and a lot of that has to do with just really exercising discretion and evaluating those instances. Does somebody need to go to jail? Is there another alternative for this to begin with? And then really just encouraging everybody to make good decisions and good charging decisions, or can we cite and release somebody for something, and then also can we maybe just change the day of the initial appearance?
Okay, just one more quick follow-up. So
Sure.
with a census of 28, how does that factor in? Like, how many people do you have in a room? Are you able to do the 6-foot distance?
Well, so social distancing in a jail is hard to begin with, particularly our jail because it's old and has been overcrowded for a long time. This is about as good as it can get to distance people when we can because, again, the population is so low. So they're doing the best they can, but it's just something we have to deal with because the jail's old and overcrowded.
Hi, Sarah Watson with the Daily Iowan. I'm wondering if you have a plan in place in case the coronavirus gets into the jail, like if you have a plan in place of next steps.
Sure. So we do screen inmates as they come in. So everybody's screened at intake for signs, and if somebody was to either display that sign or be symptomatic, we would first isolate that person and contact our healthcare provider and go from there about what to do next. Fortunately, that hasn't happened. We haven't had anybody test positive. We tested one inmate, I believe, within the last 2 weeks, and that person was negative.
Hi.
Hi.
Have any sheriff's deputies been tested for coronavirus?
We've had one employee that was, it's not a concern we had where it was connected with the jail, though.
Did they test positive?
No.
Travis with KWWL. We heard Margaret talk a little bit about how they've been getting like incomplete shipments at Mercy. I think she said some of it might be like a truck that's like in another state or something like that. But could you see a point where the sheriff's office and the deputies is there any way they could help with things like, supply chains or, like volunteer food banks and stuff like that? My question is, have you thought about other things you can do, with officers now that crime may be a little bit lower?
Not to that extent. I mean, we still have a job to do. We still have a jail to run. We still have towns to patrol. We still have rural Johnson County to patrol. Fortunately, we're in a place where we haven't had to make large changes to our staffing because, again, we have to be out there doing our job every day. People still are calling 911 for emergencies. We still have routine calls to handle. If we were in a situation like that, I'm sure the sheriff would be certainly willing to consider that, but that just hasn't come up yet.
Mitch Fick from Iowa's News Now. Is there a thought, though, and plans in place, or maybe you take it as it comes, the longer this goes, more idle time, people off the job, desperation, and maybe that's a little too apocalyptic of a scenario, but crime low now, but is there a scenario that you plan for where, maybe the longer this goes, there's some sort of uptick with people dealing with, so many, tough situations?
That's certainly possible. I think that's certainly a concern, again, throughout the law enforcement community, is how this changes the types of crimes that are either occurring and or where they're committed. I can tell you from our standpoint, for example, we don't, since our lobby is closed to walk-in traffic, we don't see the walk-in complaints and calls for service for somebody reporting a crime or whatever. So I could foresee down the road when this is over that those folks that maybe were planning on reporting something now are holding off on those reports. So I think there will be an uptick when this is over, or when things start to move back towards normal, of people reporting those things that they weren't going to report now. So we'll just have to be prepared for that when the time comes.
Sarah with the Daily Iowan again. I'm wondering what you're seeing with domestic violence, if there's any kind of resources available for people, or like if you're seeing an increase with that, with more people staying at home.
Sure. So I don't know that there's been an uptick. I mean, it certainly still happens, and it's, again, something like my last statement, it's something we're concerned about because there's that real possibility, as people are at home, especially in an environment where if there is an abuser and they can't leave now, so that is a concern. Fortunately, DVIP is still here. They're still functioning. They're still a great resource we can tap into and connect people with. What people need to understand is that if they're in an emergency situation, we are still here to respond. So if that's happening, call 911. We're still going to come to that call. All right. Thanks, everyone.
All right, and finally, we have Dave Wilson, Director of Johnson County Emergency Management.
Afternoon, everybody, and happily to announce that my voice is a little bit better. Hi, Aaron. How you doing? So I've just got a few comments. Supply chain, as Margaret mentioned, continues to be challenged nationally, but I just want to put some of that in perspective. So we went into this with quite a few commodities on hand. So going into this after the March 8th date, we pushed out nearly 18,095 masks locally. We've got another 2,000 on the way that should be here early next week, 1,000 for each of the local hospitals. VA hospital has had a good, robust supply chain that they take care of through their VISA network, and so we've not had to be involved in supporting the VA. The PAPRs have been deployed to the Ambulance Service and Medical Examiner's Office. We've provided gowns, bleach, face shields to any number of businesses, from nursing homes to ambulance services, anybody that has direct patient contact that's in a vulnerable area. And we'll continue to do that. Fortunately, we were in a much better position than a lot of the counties because we had that cash equipment on hand. And that goes back to, the Ebola outbreak, the H1N1, et cetera. So now we've depleted that, we're seeing what everybody else is seeing, a lag in the supply chain. Like I said, we have sourced a couple thousand N95 masks. They'll be in early next week, divided amongst 2 hospitals. A lot of the surgical masks as well. I think there was 10,000 of those we have coming. Some of those other commodities are just naturally in short supply, right? They're not made here in the U.S., and so we've all got that challenge. To that end, the Strategic National Stockpile was pushed out. There was a question about the Guard and what they're being used for. Part of the Guard's mission is to help deliver that from Des Moines to the entities needing it. They're taking equipment, divvying it up, and sending it to the places that have cases and the places that have needs. To that end, what we received from the state side of the supply line, is about 960 N95 masks, 1,500 procedure masks, and 1,080 face shields. So had we not had a pretty large cache of equipment on hand, we would have been feeling the pinch just like everybody else. I make that point because preparedness is really important. And Johnson County has, always been very prepared, very good at response and recovery. And we've done that because we have the support of elected leaders that really buy in and support the emergency management program and the Joint Communication Center. You're sitting in a building that was designed collaboratively through everyone in this county because we all know that any of this stuff can happen here. Whether it's a flood and we're getting alerts from the water being high, which came in today, or a severe weather weekend, which looks like we could have that as well. All those things we're not immune to any of that, right? So we know that, and luckily for us, we've had a great deal of buy-in from all of our political leaders, and that's gone on since 2007 when I've been hired. I've never had a time where, elected leaders in this county have not been supportive of the preparedness program or the emergency responders. So we're in a unique stance going into this. And that's important because we have the state's level 1 trauma center, tertiary care center here. We've got a great deal of collaboration that goes on routinely with those 3 hospitals, public safety partners, medical examiner's office, and recently we've started enhancing that communication with the 2 hospitals in Cedar Rapids and our partners up there because really this is a corridor and we routinely share those resources. So we started enhancing that a while back. We've got pharmacy groups here locally that we deal with routinely. We've got nursing homes that we've been talking to every day, 7 days a week for the last 2 weeks. They're on a call, and that doesn't change. Other thing I'd like to mention, Iowa National Guard. People are asking, why is the Guard up? So we have a Guard planner in our EOC. He's been here for a little over a week now. That's common in any disaster that we will have either a Guard emergency support person, a reservist, or a full-time Guard member in our EOC. That's nothing to be alarmed about. When the governor announced that night, Sunday night, the TAG was there, the adjutant general was there. Those people are our partners, right? They come from across the street. They're helping us do missions. They've got Humvee ambulances. They've got, military medics. They've got guys that help move equipment. So they're a key partner. The premise needs to not be that they're here for martial law or Checkpoint Charlie or something ridiculous. That's not the message. That's not their job. They're Iowans helping Iowans. And that's what they're here for, is to assist everybody get through the response. And to that end, they're a great partner because like Joyce Flynn said, they do have a lot of soldiers that they can call up. So that's what they're here for. And with that, I think I've covered all my topics. I just remind everybody, go one at a time. And Aaron, since I haven't seen you in a long time, you're up first. Sorry.
Well, I guess I wanted to ask just about the equipment you have coming in next week.
Sure.
So that's primarily going to the hospitals, or will it be administered to any other like care centers or anything like that?
We will first always backfill the 2 local hospitals to make sure their shortfalls are taken care of. The next one, our priority scale locally, is those nursing homes. Because why? They've got a large vulnerable population. So we have in our strategic plan, how we've defined this, our instant action plan is, strategy 1, keep the most vulnerable people from getting sick, right? Keep the germ out of the nursing homes, et cetera. You don't want to be a life care. Nobody wants that problem. Secondly, hospitals, nursing homes, and public safety people that are going at that, that's our number 1, 2, and 3 folks that we're going to make sure get supplies. Does that answer your question, Aaron? Okay. No. Sorry, Mitch was up. Sorry, buddy. Mitch, go ahead. Be gentle. Okay, all right.
Mike with KCRG, you were
Mike.
kind of mentioning a little bit about Johnson County being not in as much of a pinch as maybe some other counties are.
Yeah, I mean, that's just the reality of it. A lot of these counties, don't have the funds, or there's a multitude of different reasons why counties all over Iowa could be in that pinch. I mean, we've got different hazards, risks, and vulnerabilities. So the interstates are right here, 3 major hospitals, college campus, a lot of students, a lot of tier 2 facilities where no stranger to natural disasters, nuclear power plants up the street. I mean, we just have a lot of things. So we have a high vulnerability, right? And we've seen that because we have a lot of disaster declarations. So we have to be prepared. Where, I was born and raised in Lee County, Iowa. Those vulnerabilities, those hazards, that's all different down there. And it's different throughout Iowa.
Is there any conversations that happen, even if it's hypothetically down the road in the foreseeable future, that you're having with other counties about, say, the PPE order that you get filled maybe doesn't get filled for other counties who are in more of a pinch about possibly sharing your equipment or
So the state of
distributing that
Iowa
way?
handles the resource management from things coming in that the state's providing. And when we can, we have always been good neighbors and provide assistance. 2016 flood's a great example. We had equipment out the door like lightning to Lynn County, and personnel, equipment, and trucks. Quad Cities over this last fall, they didn't even pick up the phone to call us, and we had trucks on the road headed for the Quad Cities to Davenport and Buffalo, Iowa. So when we can and we can help our neighbors, we've always done that, and we'll always continue to do that because it's 6 degrees of separation. We could be the next one. The problem is, with a lot of these events like this one, it's global. I mean, you do what you can to help out, but, ultimately, a lot of those patients could end up at a level 1 trauma center. So we have to make sure that while we're helping them, we're not depleting our own resources. So it's a balancing act. Does that make sense? Yep. Does that answer your question? Absolutely. Okay. All right, Mitch. I know. Sorry.
Just building off that, it's so easy, especially in a situation like this, to split all 99 counties into their own and just put them on their own little islands. But, Dave Coach mentioned it, and you continue to talk about it, the collaboration, Lynn and Johnson, they're the corridor. They're always going to be like that. But especially in a time like this when we're not allowed within 6 feet of our neighbors, but we need to lean on them as much as we can. Yep. How important are those relationships, whether it's Johnson and Washington, Johnson and
I'm going to tell you, I give my peers a hard time all the time because this job is all about coordination, collaboration. And I get a ton of grief because, you're not in the office. Well, if my butt's parked in my office, then I'm not out doing my job. I need to be out meeting with the Eric Fishers and the public health folks of the world, or the public works folks of the world. I need to be out networking, working with the people that are in hospitals. And a lot of times it's just easier to do that on their turf, right? It's less intimidating. My counterpart in Lynn County is the same way. Steve does a lot of coordination and collaboration. So it's key. I mean, it really is. If we don't know those people and have them in our phone Rolodex, and we can't call up, the hospital CEO at Mercy Cedar Rapids or Mercy Iowa City or VA or university, if we can't get a hold of those people when there's a crisis, that slows down the response. So, I can't emphasize enough how important coordination, collaboration, and relationships are. If we have a strong relationship with elected officials, public safety folks, public works folks, and all those people that we have to lean on, depend upon when it's a flood, a tornado, Ebola, H1N1, COVID, we can effectively do our job. So it's crucial. Travis, you're usually first.
Travis with KWWL. Just since the situation is always changing, can you talk about if you have recently had conversations with any of the local hospitals about if there is possibly a need to set up, and you guys could help in this, to set up any like emergency bed facilities, or have you identified locations or anything like that?
Yeah, so we do that type of pre-planning tabletop gaming all the time. We have a daily coordination call. It goes on at 3 o'clock Monday through Friday. On that is, I think we crushed our line one day. We've got 100 lines into the bridge, and we blew it up one day. We had people that couldn't get on. So we routinely get the 3 hospitals, medical examiners, public safety folks on the line, find out what their needs are. And we've had a lot of those discussions because I go back to the nuclear power plant, right? So this was actually our evaluated year, final evaluated year for a nuclear power plant exercise as a host county. Some of those things that we've looked at when we talked about doing community testing or mass shelters, those involve places like the Johnson County Fairgrounds and the Ag Association. Those have always been in our plans. And the ILI clinics, influenza-like illness clinics, those were spun up very quickly at both University and Mercy. And so the ability for people to react on this is great. And it's been so incredible here because it's not stuff that was abstract to us. We've all thought about it at some point. When this case came up in Wuhan, China, and we all saw us right after Christmas, I tell you, a lot of people were working in the backgrounds. I can remember going to department head meetings in January and February, and they were like, how's things going? I'm like, it's all about COVID-19. At that time, we were calling it coronavirus. So, yes, we've done that. Yes, we continue to do that. That's part of the reason the Iowa Guard planners are in there, is they give us a different perspective. But we feel like we're pretty dialed into, we know how many vents we've got available. We know how many surge vents we've supported them with. We know how many people are on the vent today. If you asked me, we could share that 1,500, but that's all embargoed information, right? That we're not necessarily going to share that with the public because, again, in this circumstance, it involves a lot of patient privacy things, right? You probably won't enjoy it too much if we were sharing too much detail about loved ones in a hospital. So we have that. We keep it operationally tight, and it's not for a lack of transparency. It's because we want to respect the privacy of those folks that are in the hospital. But we do know, and we do plan on, okay, what if we're getting to 70% ventilator usage? What are those types of things? Dave Coach had spoke the other day about metrics and things like that. We look at all that stuff. I mean, that's our job. Somebody had, beat us up about, what did I give you the eye roll about the other day? Shelter in place. Sorry about the eye roll, by the way. But we think about that stuff. I mean, we're planners. That's what we do. Emergency preparedness is what we do. We think of what if and how are we going to respond to it. We're the last people that everybody wants to hear from.
Just because people's minds may be in another place, but you did bring up that you guys did get like an alert about like flood risk, and we're supposed to have thunderstorms this weekend.
Yep.
I was just wondering if you would want to talk a little bit about
Sure.
how that is still something that you guys are
you
aware
bet.
of.
So, it's that spring type of year when the weather is always a problem. Mitch, say hi to Rebecca for me. But, we think about all that stuff, and we started messaging the Corps, a week or so back and said, hey, let's really keep an eye on the water, make sure we're managing the water well. And they've done a great job, watching the inflows to the reservoir, watching the level of the reservoir, and watching how much they're flowing out. And people know us, if they live along the river, they notice without ever going to the website, they notice that it's about 7K out today. And it's, instead of 679, it's 680. But we have to keep an eye on that. We have to keep an eye on the weather stuff. Normally we would do that siren test the first Wednesday of every month. We've canceled nationwide. It was canceled for the severe weather week siren test and that whole thing because people are nervous, and we're trying not to do things to increase anxiety. So we locally said we're going to skip that first Wednesday of the month. We've got other ways to test to make sure that system works without blaring the siren, right? But we're keeping an eye on that as well. Anybody else? All right, Hillary, did I hear from you today?
So could you go through again the list of supplies that came in through the stockpile and
Yeah, you bet.
when they're delivered to specific locations? Or if
So here's the way it happens. We get a request from a hospital or whoever. We try and see if we can source that and fill that need locally first. If we can, boom, gets sent out. If we can't, it gets put in a system called WebEOC, and then it gets sent up to the state, and they'll either try and acquire that, or they've got, say, we've got it in stock with IDPH or another entity. They'll let us know that they're shipping it. Traditionally, what's been happening this event has been the Iowa National Guard make sure that they've got a truck and a crew. They go get that. They distribute it. During floods, it's usually the Iowa DOT that does most of that work. And then they'll bring that product out. And then as soon as we get it, we make sure that it's accounted for, that it's appropriately marked, and we ship it out, same day service, or like that last mile, right? Like Amazon's last mile. So we make sure that it gets delivered to them. Does that explain the process clear enough?
Yeah.
Okay.
And then what was you said there was like 1,500 procedure masks, 1,080 face
Yep.
shields. Is that what the state received?
So what we've got from the allocation that's been issued us from the state of Iowa to date right now is 960 N95 face masks, 1,500 procedure masks, 1,080 face shields, and then there's a list of some other stuff that more minor. That's what we got from the state. Most of that was sourced either from IDPH, from previously held caches, or from their allocation of the Strategic National Stockpile that was received in Des Moines or other sources. What we had on hand, though, was much larger. We had on hand going into this 17,880 N95 masks. Night and day difference in the amounts there. PAPRs, positive air pressure purifiers, so that teams aren't having to burn those N95 masks. We've got about 15 of those out. Isolation kits with the Tyvek suits, a number of those. Bleach, face shields, goggles. We're probably the only county, there might be one other, maybe AJ up at Polk County, but very few counties have ventilators sitting on their shelves. We did. Why? Because we ran into this scare before. We've got Medical Reserve Corps. My background's working for National Disaster Medical System. It wasn't really a disaster until the patients started showing up. So we've always had that stuff sitting on the shelf so that we knew ventilators are a big shortfall, right? And it takes a while to get that stuff. So we were able to push that stuff out. We've got more events coming all the time that we've got that were sourced. Does that adequately answer the question?
Yeah. So you're going to fill the local the need with local supplies first, and
We
then,
always do.
Yeah. And so you haven't yet asked for any of the.
We have.
Oh, okay.
Yeah,
You
what
haven't.
we've ran out of, we've put in WebEOC and asked them, and they have shipped us our allocation.
Okay, got
Yep,
it.
so that first smaller list of the 960 and 95s, that came from the state.
Got it.
Okay, sorry. If I was unclear, I'm sorry about that, Hillary. Anybody else? Aaron, anything else? Okay, good seeing you. All right, thanks, folks.
So that concludes our press conference for today. Thank you all for participating, and for all of our community members who were tuning in, and to our community partners. Have a good day.